Depending on where you are in the world, it may not yet be evening for you. Good afternoon, good morning. And we are mindful that indeed we are in company of other people who perhaps would be here with us in spirit. And we do this for not just for ourselves, but for the whole world. Because you are welcome again to another conversation on these very interesting topics that are very relevant to our realities today of trauma and the need for trauma healing. Today is we are holding the fourth of our series of webinars in the context of unpacking trauma and transitional justice in the Eastern Africa region and the Horn. And we have two very experienced speakers on the topic of the impact of COVID-19 pandemic on healthcare and families. And so I'd like to just welcome all of you and to give you some just introductory pieces of information. That is to tell you that this webinar takes a total of 90 minutes. That includes the input, the Q&A, the interactions, and any announcements we may have. So get comfortable and get at ease with all the questions you may have, especially related to the pandemic and its impact, trauma impact on our lives at all levels. The webinar itself is recorded so that others can also access it, and we ourselves can find it again on YouTube where it will be uploaded. So even as we interact, be mindful that you are on record. In case you have questions, participants, let's use the writing options. We can use the chat space, or we can use the Q&A section so that the moderator and other people on the team, the presenters, can read the questions and answer them either in conversation or in writing, depending on how our time is moving. So those are the preliminary introductory remarks. My name is Beatrice Churu. I serve as Dean of the School of Arts and Social Sciences in Tangaza University College. And the School of Arts and Social Sciences, in collaboration with the Institute for Interreligious Dialogue and Islamic Studies, the Institute for Interreligious Dialogue and Islamic Studies, and as well as its partners, both in Tangaza College, together with Professor Hordan, who is the founder of this process of transitional justice and trauma healing centers, the first of which is in Puntland University. All three of us are the partners in running these webinars and hoping that we can expand this conversation, which is very much needed in the region. And so we welcome you, all of you, and ask you to participate in freedom as much as you can. I would like to move today to introduce then our first speaker. If we can move the slide. Our first speaker is a very experienced person in the field of encountering persons who are struggling with trauma and other areas in which we need psychological therapy. Dr. Florence Ochanda is a counselor, as I said before, especially in the areas of marriage, family, and child play. She is, in fact, one of the founder members of the Child Play Counseling Association of Kenya. And in fact, she's serving as the vice president. Besides that, she is an educator, a lecturer in the same fields. So she practices in the Amani Institute, which is an educational as well as a practice institute in the field of counseling. Florence is an old friend of Tangaza University and indeed has been a student there as well as an educator. And so it's wonderful to have someone we are familiar with as well as someone who knows what she's talking about when it comes to trauma. And so without further ado, I would like to welcome Florence to give her presentation. And Feel free, Florence, to introduce yourself even a little bit further as you go along. Welcome.
Thank you, Dr. Churu, and good evening, good morning, wherever you are, and grateful for this opportunity to be here this evening on my side. And the topic is very relevant, even in relation to the work I do as a marriage, family, and child therapist. I encounter patients who come for support as a result of the pandemic. But it is important to note that even before the pandemic, there were already challenges that marriages, families, and children were facing. And therefore, the pandemic has just heightened a lot of what had been going on in the family context. Now, the field of trauma is, from the psychological perspective, is a very academic content. So when I was given this opportunity, I thought I would explain it first so that people can understand what trauma really is, because a lot of times you find that we confuse trauma, stress, and distress. And therefore, I thought it wise that I should be able to begin by helping people really understand the definition of trauma. Before I continue, are you able to see my screen?
Yes, we can see your screen. Thank you,
Oh,
Florence. Yeah.
thank you. And it's unpacking trauma, the impact of COVID-19 pandemic on healthcare and on families. Now, what is trauma? And before I look at trauma, let's look at the pandemic. Generally, not generally, the pandemic is an epidemic of an infectious disease that spreads across a large region. And that is what we have seen in relation to the COVID-19 virus. And it hits multiple continents worldwide, you see, affecting a substantial number of people. Now, in our context, in relation to the definition, an emotional response to a terrible event that is frightening, dangerous, or violent, you know. And this event is as the individual perceives it, because not everybody was frightened, not everybody felt threatened at the same levels, and therefore it is important to acknowledge, and therefore frightening, dangerous, violent, and poses psychological or bodily threat. So when we look at the pandemic, especially in the context of Kenya, when we first had the first person, and then there was a lockdown, we were not able to move. Even getting out of your door was very difficult because of the fear and worry. And because of the way it was presented to us, it came across as something that was very frightening and dangerous. So even the way the lockdown was done in our context frightened everyone, because life suddenly stopped. We couldn't go to the shops, you know, at night you could see violence with the police, and there was a lot of threat that was posed to the individuals when it came to the pandemic. Now, it has been said that 70% of individuals, according to data and research that I read, of course, these are very specific researchers, have experienced trauma in their lives, 70%, which is a big population generally. And then 20%, 70% have experienced trauma, and the other 30% are those who might not have been affected. And there are those who, according to data, 10% were not placed anywhere in that data. So therefore, traumatization occurs when the internal and external resources are inadequate for an individual to cope with the external threat. So when we look at this event that is very threatening, one of the things that is very important is that the internal resources, these are things that are within us that support relaxation, support safety, strengthen us. Instead, these capacities were overwhelmed by the external environment, and therefore most people were not able to cope with that external threat. And I want to give an example, especially in our continent. When the first coronavirus casualty was being buried in our context, the way it was done was very traumatizing to the family, in the sense that they were not allowed to get the body, they were not allowed to view it, they were not allowed to touch it. And even the way it was buried was very traumatizing to the family, because the body was not put in a casket and lowered properly. We could just see a body that was thrown into the grave, and people were cringing when they saw this. So you can see that that threat, especially for that family at that particular moment, was very difficult. Their internal resources were overwhelmed. And that is when traumatization occurs, when you're not able to cope with that external threat. And so many other events have happened. For example, as a result of the virus, even catching the virus itself has become a very traumatic incident for most people, because of the fears that people have underneath. So for example, if I catch corona, especially when it came in the first instance, a lot of the experience was that if you catch corona, you're going to die, which was not true, because as we have journeyed across board, we have seen that yes, you can catch coronavirus and still live, but also there have been casualties. So that part of I'm not sure where I stand if I get corona seems to plague people's mind a lot of times. Now, for people who worked in the healthcare, because they had to handle the sick patients in the hospitals, as they kept seeing many patients, one of the challenges that they felt was that because I'm in the front line, what are the risks of me catching this virus? And what is the risk of me taking this virus to the family and to the children? And I remember in one of the centers that I worked, the medics were not able to go back home. So they had to find a center to keep these medics, because sometimes the families were not ready to receive these healthcare workers. So you can see families were struggling, and the healthcare workers are struggling at different levels. And even as the healthcare workers continued working, one of the threats that that continually came into the mind, especially those who worked in the emergency rooms and then in the ICU departments, was just the confrontation of their mortality each and every day, because patients came in, you worked in a quarantine area. So there was a lot of stigma, and therefore traumatization therefore occurs. Now, in relation to trauma, it is important to acknowledge the three E's, as we call it: the event. So in this case, the event of the pandemic, how it is transmitted, and the impact that it has, especially the death aspect, is very important in trauma, because it is the way that person experiences it. So that experience by the individual at the psychological and the emotional level that is harmful, and then the long-lasting effects that they have. So these three E's are very important. So for every experience, remember, every experience triggers our thoughts. Every experience that we go through also triggers our emotions. And every experience that we go through trigger our behaviors. So you can imagine the thought process, the emotional response, and the behaviors are very consistent. So if you go through a happy experience, your behavior will align with happiness. So you'll not find yourself doing very difficult things. If you go through a difficult emotions, a lot of times, especially when it comes to trauma, the behaviors also become negative. So it is very important to note that even as people were going through the experience of trauma, there was a lot of physical and there was a lot of emotional harm. And those were the areas that have affected individuals in the family and has affected individuals within the healthcare setting. Maybe a question that I might pose to the participants in relation to the definition of trauma, and if it can be put in the chat, I will really appreciate a minute or two, because I know I have a very short time. What experiences might be traumatic for you during the pandemic? What experiences, not the word experiences. So if we can have maybe 1 or 2 or 3 in the chat, kindly please jot it down. I give us a minute to just put it down for the participant. What experiences might be traumatic during the pandemic? And if there's anything in the chat, you can read it out.
So loss is coming through.
Loss.
Jackie speaks of loss.
Loss.
I want to encourage our participants to participate. I want to add the inability to visit with our loved ones, especially the elderly up country. And they had trauma from not being visited by their children.
Yes.
Financial difficulties is coming through.
Financial difficulties.
Misinformation. Joyce speaks of misinformation. John is talking about loneliness. And Nancy, who worked in an isolation center, says that it was like facing death daily. Conflict in family due to my choice to work in the isolation center. So the family, so 2 things there. Facing death daily was difficult, and also conflict in the family because of the choice to work there. Mariam is talking about the loss of work, which has happened to a lot of people.
Wow. And you can see how these experiences, the pandemic environment facilitated a lot of this. There was a lot of loss of loved one. Why does loss become a traumatic event? It is because it is frightening, it could be dangerous, and it poses psychological threat. You can imagine financial difficulties. So lack of financial ability means that there are many areas of your life that will struggle. So if you have children in school, you have to change schools, reduce lifestyle, a lot of conflict that arises with that because spouses were not able to get together and understand each other and work together as a team. Remember, I'm saying that there are usually pre-trauma issues. Pre-trauma, they're normally issues, the issues of the personality of these people in the family, the gender issues, the schemas that we hold, the life goals, the age, the culture. All these are always there before the trauma. So when trauma comes, it already finds a fragile people anyway. And therefore the capacity to handle the magnitude of loss, the financial difficulties, facing death daily is very difficult and frightening. Conflict in the families, you see, not able to even visit our families and our aging parents, sometimes not even able to get to see your parent. All these are very traumatic events, and that is why the pandemic environment. Now, trauma becomes very complex as well, because one trauma occurs as a single event, and therefore it can, sorry?
You might let me just read you 2 or 3 others that came through so that you can integrate them. The sense of the unknown, not knowing what to expect, being at a loss about the future. The loss of loved ones, especially, and also breadwinners, leaving families really in very precarious situations.
Absolutely.
And then we were forced to begin registration and classes online. So someone is in school and suddenly their learning environment changes. And there was no proper preparation for it. Learning online was traumatizing.
Absolutely. You know, especially in our context, the lack of bundles, the resources to stay in class all the time. Sometimes Kenya Power goes off and you're thrown off the class. I mean, it was so traumatic. And you see, uncertainty uncertainty raises anxiety automatically because human beings love predictability. Idel, I noticed that my time is 20 past.
I would like, you can take a few more minutes because
okay. So again, when you look at the stress response of the individual person, there is the flight, flee, and flight, free, freeze. So in the flight, free, freeze, the thinking brain and the emotional brain work together. Now, the thinking brain is very important, and you will realize that in trauma, the thinking brain is overwhelmed. Why do we need the thinking brain? The thinking brain will help you to analyze a situation. The thinking brain will help you to work with the reality. The thinking brain will give you an opportunity to reprogram yourself again. But if you work from the emotional brain, you're reacting. And so you don't have the capacity to do things differently that would sustain your well-being. So you respond from the emotional brain. Now, that alarm, so in trauma, that alarm in the brain keeps going on and on and on and on, and it doesn't shut off. So that any experiences that you experience in life become threats. Remember, the human being is wired for survival at all costs. So anything that will threaten an individual, I'm battling with time. Anything that will threaten our survival, therefore, will make us not to cope positively. And those are some of the issues that we come. So you can see some of the difficult reactions that you see in trauma. And by a show of hands, how many, if any of us experienced any of these symptoms during the pandemic and even now? In my practice, there's a lot of insomnia, there's a lot of depression, there's a lot of nightmares, there's a lot of worry, there's a lot of rage. And that is why if you look at in our media, there's a lot of killings and fightings and violence that has just gone another level because people are not able to cope with all these things that you're talking about. So we are like a time bomb. So you touch me a little bit and I explode. And because these experiences have not been debriefed over time, and these experiences, people have not taken time to debrief where they are at in relation to their experiences, and therefore we are a very fragile population. Now, when it comes to the recovery, one of the things that is important is that we need to develop resilience and rise above, then move into the recovery, and then develop post-traumatic growth. One of the dangers that I'm seeing in my practice is that there is severe persisting distress. So there is a decline in mental health. And then we are at the stability of maladaptive functioning because we've not been able to adapt successfully when it has come to the trauma. Maybe I can stop at that point, Idel, because I noticed that time has run out. Thank you.
Thank you so much, Florence. There is so much that can be said. And I noted that as you asked us to respond, we were coming from, deeper memories of some of those traumatic experiences we had, especially at the very beginning. And some of the people participating here are also therapists, and they can relate very well with you, even as a person who accompanies others. I want to thank you very specially, but and tell the participants to keep conversing with you in the chat box, but especially in the Q&A section. You can raise a question, you can raise a comment to what Florence has said so that we continue the conversation. And there will be a time at the end when she can get back to us, answer a question or two when we are done with what Mariam is presenting. And so we keep the conversation together. Thank you so much, Florence. So that we keep in tandem with time, I'd like to have the picture, Susan, please put up, of Dr. Kazim, so that we can see her face. And if possible, Dr. Kazim, if you are in a position to open your camera, that would be really nice, so that as you speak, people can see you. Dr. Kazim is a medical doctor, so you can imagine her experience with the pandemic. But even before the pandemic, she has worked a lot in this region, as well as elsewhere in the world. And at this moment, she's serving as a consultant with the United Nations Population Fund. And at that level, there is also a bird's eye view of the experience of this pandemic as it is impacting the world and the continent of Africa in particular. So without taking any more time, we are excited, Dr. Kazim, that you could make the time to be with us, and we look forward to what you have to share with us. Welcome.
Thank you very much. Good evening, everyone. I'm really very happy to be with you today. This session was very interesting. From my side, I haven't any PowerPoint presentation, but I will focus on the issue of access to healthcare, access to services during the COVID, how it impacted. So when we are speaking about access to healthcare services, although COVID-19 pandemic had a major impact on the capacity of health systems to continue the delivery of essential health services, there was and there is always a difference between low and high income countries. Also, there's difference when it comes to different backgrounds, socioeconomic backgrounds, different communities, different households. The situation was not something like a uniform. How it impacted depended a lot on other issues like the social determinants of health. So I would like, before entering the impact of COVID during the pandemic, let us look even how the access was already prior to the pandemic. For example, in a country like Somalia, where I worked at different levels, access was, we were already struggling to access a good health care or health services. And many countries in Africa are more or less the same. Due to fragility, due to weak health systems. So already there was an issue with the access even prior to the pandemic. A limitation of resources and the insecurity, instability, there were a lot of things already affecting. When you look at my own country, Somalia, where I served even as a minister 10 years ago, at that time, the maternal mortality ratio, if you look at it, it was one of the highest in the world. Again, the under 5 mortality, morbidity. So you could guess the situation of the health system, because already the country was post-conflict, very fragile, and the system was very weak. When you have a very weak health system, which mainly depends on donors' money for the funding that comes from donors, and the rest of the population, maybe they use the private sector, it's out of pocket money. So you can imagine, even prior to the COVID, that people were struggling with access to good health quality services. Said that, then after the COVID, due to the lockdowns, due to the financial situation, which became very difficult, people living on $2 per day, working when you put lockdown, and they cannot go to the market, they cannot work, access became even more difficult. And whatever resources that were there, the staff were being diverted from their normal activities to cope with this COVID. So that is what was happening in Somalia and is still happening. But again, let us look at the most developed countries. During the lockdown, I was in the UK. I went to the UK just to stay 2 weeks. I arrived in London on the 7th of March. COVID was there, but it was not, the WHO were still saying that it is a public health issue of international concern, it's an emergency, but nobody was speaking about the pandemic. Then when I arrived in London, few days after that, people started about speaking the pandemic. And on 23 March, UK entered lockdown. So the amount of fear, the amount of uncertainty, the amount of stress, before even coming to the health issue, to the access issue, people running, going to supermarkets, people, everyone is looking to get as much food as possible, bringing everything. Even if you go to the supermarket, you cannot get even a toilet paper sometimes. Because people were, everyone was panicking. That was the situation in London. When you look at the NHS, it is one of the best services that is there, the NHS, the National Health Service. It was working, it was functional, billions, the resources, the money, billions of British pounds were there also for fund the NHS. Again, that country with this developed technology, with this good economy, it's suffering a lot. Up to today, this morning I was reading some journalists and some articles from British Medical Journal. This morning I was reading that the waiting list is above 5 million. 5 million people are in waiting list. Meaning that during when the pandemic started, everything was shifted to cope with the pandemic. The normal surgeries, the normal treatments, just they were being delayed. Some people even who could have just a simple surgery, because of this delay, they deteriorated, they become worse. So you can imagine delaying all this, how much trauma it costed to the families when you are ill and you cannot get service due to COVID. From one side, the hospitals, all the system is overwhelmed. The GPs overwhelmed. Everyone is dealing with COVID. And from the other side, even you yourself you are afraid even to go to the hospital. You are afraid even to search, to look for help. Some people with heart problems, okay, they have angina, they are experiencing maybe heart attack. At the same time, even if you go, will you get help? And going is, you are afraid because the hospitals were overwhelmed. Each day, the death, like 900, 800 deaths when they are telling in the TV, then you will think just stay, manage yourself. So it was not an easy situation. I was in London. I was with some of my sons, and most of the time, I wanted to get information. I'm looking at the news, the death rate, what is happening, how is the health, the NHS is coping with all of this, what will happen. And this thing was new, and people were speaking about, there are not enough ventilators, not having enough oxygen. So I'm always 24/7, I'm looking at the news. One of my sons was telling me, stop this TV. We don't want to know. We get more stress. It is not helping. When I tell him, today, do you know how much also the death rate? Don't tell me, I don't want to know. So that was the way people were reacting. So if a country like England, for example, suffers a lot. So many people lost their jobs, again, the economy. Then when, okay, it was not affected in the same way. Those who suffered the most were people from ethnic minority backgrounds. Again, we have this issue of social determinants of health, the housing. People from ethnic minorities, the housing is not as those that the people who have a good income. So the housing issue was also a part of that. When they look at 2/3 of the people who suffered or the death were from people from ethnic minorities or immigrants or those. They were doing a lot of research and papers. Why? But it was very clear because the socio-economic background is an important factor. Then they introduced this telemedicine, using this online and calling the GB, online videos or phone calls. Even that's not available for everyone. Someone who is already disadvantaged, even maybe they don't have access to the internet. So the impact was different. It was not the same for everyone. It was different for different countries. It was different for different households, people who couldn't offer. I saw most of the people, Uber drivers, cleaners, working in care homes, you cannot work from distance. You have to go. Then coming back, you have elderly at homes. So those were the communities that were affected the most. So for different households, it was different. For different countries, it was different. More or less, what we saw was that even the countries that we thought were prepared, they saw that the emergency preparedness was not enough. So coping with this, people learned a lot now, and they are focusing on this telemedicine, digitalization of health service, all these things. But again, when you come to a country like mine in Somalia, it's not there. So I would stop at this, and I welcome if there are any questions and if I can answer.
Thank you very much, Dr. Kazim. Thank you for your input and exposure of your experience, and especially the real questions we have about the social determinants of health. I like that you referred to the experience on the ground. I must offer that I myself was shocked to realize how few hospital beds we have, even before COVID. Before COVID, I had no reason to take a great interest in that. But suddenly I realized when they say all the beds are occupied, and then they give you the count in each county, and we really get surprised how poorly prepared we are, even for ordinary situations. Now, in a time of crisis like this, we are really, really badly off. And so, of course, there are many other justice-related issues underlying these ones. Okay, thank you for your input. I invite questions and interaction. And I would like to address our two speakers as I wait for other questions on the issue of resistance to vaccines, because there is quite some resistance of vaccines. And I want to ask for what is the international experience, because it's not limited to Africa. What exactly also from the psychological perspective might be the reason? Are we meeting people in counseling settings who are talking about their resistance to vaccines and their fears related to vaccines? In the meantime, I invite other conversations. Anyone want to answer that? Florence, as Dr. Kazim takes a breath, and also answering the other questions that came in, very interesting questions. There was a question for you, Florence, about how do we build up resilience to these complexities that COVID is coming along with in our lives? How do we build up resilience, given that it's such a long-standing challenge? Florence, over to you, please.
Thank you very much. In our context, maybe speaking specifically for the context in Kenya, of course, Dr. Churu, there are those who are not taking their vaccines. They will not take it. There are also those who have responded to it positively. So, and there are many reasons why they give. So there's a lot of fear, there's a lot of uncertainty about it. I think there's a lot, there needs to be more done in terms of education to help people understand. When we look at the countries, the developed countries, I think a bigger portion is taking the vaccine. There could be a portion that is also not taking, but there's a portion that is not taking the vaccine. So it's a mixed bag in our country. In families, I think one of the conflicts is that maybe the husband has taken the vaccine and the wife has not taken the vaccine. So there's a lot of animosity in terms of if you go out and you come back and you're not vaccinated, you're bringing the COVID. So sometimes the conflict is just now around COVID, the taking and not the taking. And now that escalates around other issues. I also have friends who, because their husbands are working from home and the wives have to work outside, there's a lot of stigma. For example, if the wife comes back from where she has come back, she has to change outside. She cannot relate with the people. She still has to sleep on the other side of the bedroom because the husband doesn't feel safe and she hasn't taken the vaccine. So there's a lot of complex issues around the vaccine taking and not taking that is also pushing families to different levels. When it comes to resilience, I think one of the things that is important to acknowledge that life will challenge in us at some point. It's gonna hand us something unfair. It's going to take something away from us. It's going to interfere with our plans. So at that point, when this happens, the question is, will you let yourself thrive in the face of adversity, or will you diminish in the face of adversity? So post-traumatic growth actually helps us to find purpose in the trauma and even make the world a better place. At the end of the day, either to cope or to thrive is the prerogative of the individual. There's a choice around it. And when I talk about resilience, it's the ability. You see, now again, we are using our mental and emotional capacities that trauma affected. So it's that ability to mentally or emotionally cope with a crisis and return to the pre-crisis status. I know it might not be easy because of many factors, and it's a process, but it is important to acknowledge that it is a challenge, but look at it in both ways. Either way, either you'll suffer or you'll flourish. So when we look at resilience, it's what are some of the things that we can do is to find supportive relationships with people who care and people who value you and people who are able to stand with you. One of the things that is also very important is to develop a sense of mastery over life circumstances. So over the pandemic, maybe if I ask the people in this webinar this evening, what mastery have you gained over your life circumstances, especially in line with the coronavirus? I would want to see answers on the chat. What sense of mastery have you developed over life circumstances, especially during the pandemic? Anything that is coming through in the chat? It's a deep question.
Yeah, a chance for you to think a little bit proactively. What have you done? What sense of mastery have we developed? We can't help others if we can't even help ourselves. So that's a really good question. So Florence is posing us a question. In the meantime, let me read you a response from Dr. Joe Gitao. He says that he has had some clients who contracted COVID-19 after vaccination. And the other family members then found it difficult to accept vaccination, and both parties were going through the stress of deciding which way to go. This whole thing of uncertainty is very persistent, and even the experiences are not very reassuring. Okay, so what?
Dr. Churu, hang on a second.
Yes.
Hang on a second. I think one of the things that we have been told consistently is that just because you have vaccinated does not mean you will not catch the virus. The issue is you will get it, but in a low capacity, the impact will not be as heavy. Dr. Miriam is the expert here, but that is my understanding. You will still get the virus, but it will not affect you to that higher level.
Thank you. Among answers coming to your question is a lot of self-awareness. Farida says self-awareness has been somehow her shield, and maybe it would be lovely to understand better how that becomes a shield or a coping mechanism, but lots of self-awareness. Farida, thank you, Farida. Mariam says remaining positive and avoiding all negativity. Again, Mariam, very good. And just wondering, how do we do that when the news of more and more deaths keeps increasing? It would be interesting. Other answers, how are people coping? I'll let, if it's okay, Florence, I could let people answer your question a little bit as I address a question or two to Dr. Kazim. Is that okay?
Yes, yes, absolutely.
When you get a chance, I would like to have a comment also. Thank you.
Yes, yes, Professor Hodan, thank you very much. I noted your hand was up and then forgot. Thank you. Karibu. Professor Hodan, go ahead. You are muted.
Okay, first of all, I want to welcome our two ladies who really gave amazing analysis on COVID and its after effects. So for that, I want to congratulate the program and also to the speakers. I have a question for both of you. The question of trauma, given the fact that it's so massive and it encompasses many different things, both social, health, economic, livelihoods, psychology, so everywhere. Is there any way or anything in this area, in the Horn, or people of East Africa? I don't see the policymakers addressing this important issue. And we know we already have generational trauma from civil war, from election conflict, from inequity of economic, social, or whatever political resources. How do we unpack that and communicate to the policymakers? Because we are here from academic level, we are trying to identify these things exist and it's happening to real people and it's impacting their lives, and whether they are resilient or whether they go out and get crazy, these things are real and it's happening. So how is it passed beyond the academic to the policymakers who can come up with policy implementation regarding this issue? Because trauma is real and we had other traumas, now this is impact on the top of it. So I will, Mariam, who has been a minister for one time, maybe 5-6 ministers at one time, health education and so on and so forth, youth, and now heading the UFPA, which they, I don't know if they deal trauma. So that will be international perspective. Maybe you can tell us. Are we not addressing or resources being earmarked for that? And the other question I have with my the psychologist is that, okay, in Kenya, what is it that you can think of from policy level can be done? Thank you. Over to you.
Thank you, Professor Hodan. Thank you very much. Very well articulated questions. So I'd like to give the first chance to Dr. Kazim from your great experience and these questions of policy and government's responses and how academia can possibly help to improve or to inform policy. How might it be more effective? Dr. Kazim.
Can you hear me?
We hear you well, thank you.
Yes.
Yes,
Okay, that was a really good question. Because when you look at the WHO Constitution, when health is being defined, health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So physical and mental well-being are equal, and also social well-being. But it seems that when we are in countries like Somalia, just due to the meager resources and due to the lack of knowledge, just people ignore mental health. We focus only on physical health. So trauma is part of mental health. In our society, it is like stigma. Anything related to trauma or mental health, they don't even acknowledge that it exists. So how academia, if I come to the first question, how academia can help this, in order the decision makers to make the policy makers, those the high level, when they are making decisions, what is very important is to have evidence-based and facts. So when you publish a paper speaking about this, how trauma is important, how mental health is equal to physical health, then when the person in the high office, when he gets access to this information and it is evidence-based, so decisions can be based on this. Then the high level, the policymakers can make decisions based on this evidence, on these papers, on this academic work. That is where it can help. What I think is that. The other thing is now Somalia, we started the universal health coverage with the support of WHO. So before we had this, what you call essential package of health service, I was trying in this essential package of health services to put also mental health. So when you have mental health, then you have all this trauma and everything. So while now Somalia is in, we launched, I think the ministry with the support of WHO, they launched the universal health coverage. So I hope that we can lobby for that mental health is part and parcel of this. And when you have the mental health, then under that umbrella, we can have trauma, stress, whatever, depression. I know in Somalia now, for example, this depression that affects women after delivery, postpartum depression, nobody recognizes it. But what I know is in Somalia, it's very high. Even when I was growing up, I used to see women after delivery, the old women, they arrive, they put some stuff, traditional stuff for protection. They think that after delivery, woman is vulnerable for other spirits, for the devil. So this postpartum depression was there, but nobody knew. And now it is very high. Trauma. All this will come under the mental health. So if we can convince the decision makers, the policy makers, if we can convince them and present them with a piece of literature speaking about this so that they can make decisions based on evidence, I think it will be packed in this universal health coverage. And then we have this statement from the WHO Constitution itself, that physical, mental, and social well-being that are equally important when we are speaking about health. I think okay. Is that enough?
We will come back to you. That is very, really very helpful. There is a lot of academics here, budding ones and experienced ones. So it's good you are throwing the challenge at them that we need to produce the evidence to inform policy and publish. We are on the ground and we've got skills, and what are we going to do? Can we make our contribution? So I thank you for throwing the challenge to this community, because I think there's more we can do perhaps than we are doing. And it's a really very good question. And Professor Hodan, your second question was to Florence. Florence, are you ready?
Yes, and maybe she can repeat the question.
Prof, kindly. Please unmute.
Yeah. Oh, okay, my question was, okay, I was asking Marian from the health providers perspective, especially international communities. I'm talking about things that we can do here in Kenya or even in Horn of Africa in general, as to how we can internalize these issues, because they're real, and we already have, as I said, packs and packs of trauma. And if we allow this to continue, because these people, they just didn't get trauma and move on, they're still suffering from it. As you said, some of them might have developed depression, this and this. What is the way forward? How are we gonna, apart from being in that field you are, what will you share with us in terms of how to move forward? Because in America, as you know, there are mental health centers, both owned either by private individuals or owned by the government. And sometimes it's open to people who are suffering from any sort of trauma, serious mental illness that requires a psychiatric help or even counseling. So like now, a lot of the American kids who were isolated through the Zoom studying, now they're going back, and I understand that they will be getting some sort of a counseling when they go there. And this is available to anyone who want to talk about it. So we have here in Africa, or in the Horn of Africa, or even in Kenya, and people are suffering. Are we going to go business as usual, or what do you think that needs to be done? Thank you.
Thank you so
much. Over to you, Florence. What do you think needs to be done to mainstream these support services? Because we cannot go on with business as usual. Florence.
I agree. And you see, thank you so much for that very important question. In our continent, mental health, first of all, is not a priority. In our continent, it's only recently that people are beginning to appreciate mental health. And even the government has taken little steps. It might not be large, but very small little steps to start acknowledging the aspect of mental health. So if you go to the government hospital like Kenyatta, which is our major referral hospital, we already have mental health services that people can access. However, people themselves are still at the stigma level. So there needs to be a lot of advocacy on the ground to ensure that people feel safe and comfortable with the service, because the service is there. If it is there, it is there. If you go to the government hospitals, it is there. If you go to practitioners, it is there. However, also the question of the service is expensive when it comes to private practice. And when you go to the government side, there is also a lot of bureaucracy in terms of the queues are long and you have to wait. Sometimes you might not get the service at the point that you want it. We have a lot of challenges that we need to restructure. Now, trauma-informed care needs to be part of our, needs to be ingrained in our society, and people move from the shame of seeking the service. Because if I was to ask, other than the professionals themselves, how many people have sought counseling because of the pandemic? Because when we are talking about resilience, you cannot solve resilience through a webinar. You can solve resilience through a personal process. How many people, we are 44 people in number, how many people have sought therapy for the challenges that they're facing? I want to see from a show of hands. If you feel safe to raise your hand, how many people have sought services? Because of the trauma issues of the pandemic. So 2 participants have raised their hands. Allow me to use that data. That is very thin. So the challenge also goes back to the individuals, because we have an individual responsibility for our healing. And if we don't take it in our hands, then it becomes very difficult. Then once we take that responsibility, then we go to institutions that would offer us what? Trauma-informed care. So trauma-informed care gives people opportunity to seek the service or treatment for their healing. And so for us in our context, there still has to be a lot of education. We still believe that we solve our problems by ourselves and we don't tell anyone our problems, so we die with our problems. So we also contribute quite a bit to the challenges that are there.
Thank you, Florence. I like that besides the individualized self-care and reaching out, but you talked also about advocacy for mental health as and as something to claim and something not to be ashamed of when we have challenges. And I want to recognize that mainstream media and sometimes even social media, people are using it positively to promote a better understanding of the mental health issues behind some of the violence and some of the difficulties we are undergoing, so that we can address problems from the source rather in a reactionary manner. And so there is something we can do individually, but there's something also we can do corporately. There was a very good question.
Hang on a second, Dr. Churu, allow me to cut you short. So when we eventually get to the point of having trauma-informed care, the trauma-informed care services recognizes the presence of trauma, the symptoms, and acknowledges the role that trauma may play in individual lives. And so at the organizational level, the care, then the organizations therefore have a culture to emphasize respecting appropriately and responding to trauma at all levels. And that will be helpful. Now, that practice and awareness becomes second nature, and therefore is supposed to be accessed by anyone, everyone. Thank you.
Thank you very much. Thank you, Florence. I want to go back to Dr. Kazim and just say there's a really nice question raised by Farida. I think Professor Hodan began addressing it when she says that some people, first of all, let me read the question, that what coping mechanisms have worked in other countries that we can perhaps copy from? That bigger view, because as Professor Hodan was saying, in some countries, there are support systems even for children trying to learn online and the isolation that's coming to them. Maybe Professor Dr. Kazim, you can tell us a little bit more about what other countries are doing that perhaps we could ape that might, or adapt, that might help us. Dr. Kazim?
Yes. And when you look at the different countries, again, it comes to 2 things, what they are doing. First of all, the availability of the resources and the allocating of such resources to mental health issues, trauma issues. In some places, they have centers, counseling, and where even you can take children, sessions for children, sessions for women, some centers that they can go and they can get those services. And it comes again to having the adequate resources.
Thank you. Professor Hodan, I wonder whether you would like to say something about the Trauma Healing Center that you founded. there are questions and even wishes that we could have centers for trauma healing. Could you inform us a little bit more about what services can be rendered here?
Well, the vision is we have actually done some, there was a center in Puntland State of University. As you know, trauma healing is multidimensional. One is, as you all talked about, providing the resources, providing the necessary infrastructure for those people who need. And we have the center could help, we're just looking at the COVID trauma because it's timely, it's happening, it's just unprecedented. It will be very, academic cannot ignore these kind of things to be explored and discussed and talk about and come up with suggestions and things way forward. But in general, Trauma Healing Center, Transitional Justice and Trauma Healing, as the name implies, transitional justice, you can have trauma, but only after injustice has been committed. In our region, wherever that might be, it's happening now in Ethiopia, it could happen anywhere where election is upcoming in Somalia. It's a lot of trauma now. So you could have a political inequity trauma that's resulting from lack of transitional justice, economic inequity, because even the commonly owned resources are not common to all. So how do we make, and the whole point of the center is, on one hand, we could have a clinic, a law clinic, for example, for those people who are traumatized by rape or domestic violence or abuse or whatever that might be. There might be a law clinic that help them get their things in order. There could be a health clinic, as we talked about. So it has multi-dimensions, and we are still working on this one with Gaza University. So I think it's much needed center that will encompass a lot of things. And in fact, even if it's not as successful as we plan to be, it could at least raise consciousness as to be this trauma to be identified and find ways to cure it or to deal with it. So yeah, it's beginning. Anyone who want to, want to start this is actually welcome. And Dr. Juru and I and Susan and all of us are trying to, our webinar was just a way to get feel of how that will be, raise awareness, let the people identify what trauma is, but different dimensions of trauma, transitional justice issues, all these are actually, and the mental health, I think, is something that in Africa that hasn't been addressed. If you look at the literature, academic literature, and I did check this, the way it is, it's developed in the third world, but we actually inheriting a lot of the problems, but we're not getting all the resources we need or all the, identifying the problems. So actually we could be like having maybe 1/3 of the population to be passionless zombies, or who need help and we're not able to provide that help. So I think the first thing we would like to do is provide at least information and advocacy, and also how to identify this issue and how bad it is, because there is a generational trauma coming from, 1800s when Africa was carved up. And then, of course, the way we ruled, there's an issue with Somalia, and there's a political trauma and transitional justice. All the borders that has been drawn are causing problems for Africa today, and for the Horn, for that matter. And people are dying, people are internally displaced. All these things are a result of issues of transitional justice, but the resulting is a trauma that actually impacts people in a very meaningful way. Thank you. Over to you.
Thank you, Prof. So friends participating, we want you to note that we are trying to start this center, and your input can be helpful, even in terms of encouragement, in terms of raising questions, and in terms of learning more from other experiences, so that we can have a center that responds meaningfully to the challenges in our region. Thank you very much, Professor Hodan. I noticed we have a lot of interesting and nice comments, and I know I can't read all of them because you can read them yourselves, especially the response to the question that Florence raised, what people are doing proactively to keep themselves well and hopefully to reach out to others. So I do ask you to keep reading those. Lucinda, I think your hand was up. I don't know whether it's up in response to Florence or you would like to say something. Lucinda Muga, you want to speak, Lucinda?
No,
Lucinda?
I'm sorry, no.
Lucinda? No. Okay, when you're ready, let us know. I want to just pay attention to one or two questions, excuse me. Dr. Narugala has raised the question about, and I think this must be going to Dr. Kazim and perhaps, and even maybe you, Florence, because you have experience from a variety of populations, that perhaps since COVID affects everyone, how about those people who are refugees, migrants, people without IDs, who suffer social injustice in accessing healthcare, accessing counseling services? What can we do to reduce the trauma experienced by these people? So just to say that while COVID is affecting everybody, it may be affecting certain already disadvantaged people in more particular ways. And so I'd like to invite a response to that from Dr. Kazim.
Dr. Churu, I really acknowledge that that is a gap and it's a challenge. However, we have non-governmental organizations who work in these regions. And from my experience of traveling to those regions, they have services that they offer. It might not be adequate enough, but at least they have the service. It's offered to them. I'm aware about that.
Thank you. Dr. Kazim, would you like to say something to that or to any other of the other issues raised? I don't know if you are muted.
Dr. Jero, there is Suad Abdullah. I don't know if you see her comment. Somebody, as an adult, the question that...
Yes, a very good, yes. As an adult, it's difficult to admit mental health issues due to cultural issues. However, if we start at school level, incorporating social and emotional learning into the curriculum, it would be very beneficial to children and young people. I couldn't agree more. Really very helpful input there. I hope I'm not reading the name right. It's okay. Thank you. Very, very helpful comment there. Thank you. Okay. I don't know whether I'm missing another important piece that has been shared. We are coming close to the end of our conversation, and I just want to thank everyone for participating. And I would like to invite us to keep this conversation really alive and to make our communities realize that this is something we must speak about. There's a comment there from Joyce Wayaki, a trauma center where when will it happen? I believe it would help address mental health in an environment that understands the problem. So an encouragement for it to start. And yes, it's starting in the context of this collaboration between Professor Hodan and the institutions in Tangaza University College. And we want to be able to reach out to the whole region. And how we do that is something, it's in the works. So thank you very much. Okay, compulsory counseling. I don't know about compulsory counseling, Farida, but counseling for sure would help us if we can make it interesting. I mean, make the students understand how important it is. I must say, as an educator, I'm particularly charmed by this idea of social and emotional health education in our schools so that we grow up recognizing it as something that we need all the time. Very good. So Dr. Narugala, would you like to say something before I hand over to, we are going to move towards closure. As we do that, I would like to request Susan to paste for us the tool that we used for review of these sessions. These sessions are getting closer and closer to the issues that affect us. And if you can help us with your suggestions and feedback to improve our sessions, we would be very happy. So Susan, we post in the chat box right now the link that helps you to answer a few questions that help us to evaluate and survey the way we are going forward, how we can go forward. In the meantime, I want to check whether Dr. Nalugala had something to add or any of the panelists. Florence, parting shot will be asked of you. If we still have Dr. Kazim, I think we no longer have her, but in case she comes back, we'll give her a chance to give a parting shot and then move to closure, which will be done by Susan. So Dr. Nalugala?
No, thank you, Dr. Idel. I think it's been a very lively discussion. These sessions always call for more time to get deeper, but time is always our enemy. But the discussions were good. I really appreciate what has come out from this discussion. And as you said, Dr. Idel, we keep the conversation going. Thank you very much.
Thank you very much. Thank you. And Professor Hodan, you have to add something?
Not really. I think it's been great. I like the discussions and the questions and the discussions. I would like to thank our sister for staying with us longer than we expected and providing really thorough and an amazing understanding of what the COVID, the feeling of the people, how traumatized they are, and hopefully we can do something with it. Take it from here. I appreciate all of you, Susan and Dr. Chiru and all of you, and the students who've been with us, or not only students, but the people have been, it's been about 44 people here. So we wish them all the luck, and hopefully this might need like a village to build this center, because it's really, it will be very useful for the community.
Thank you, Professor Hodan. Thank you. Parting shot from Florence.
Yes, I think maybe just picking up on something before I give my parting shot. When it comes to issues of generational trauma, remember it's a traumatic event that began decades prior to the current generation. And a lot of times this has impacted in ways that individuals are not able to understand with and cope with and heal from. Now, remember when it comes to intergenerational trauma, there is normally the aspect of history versus memory. So most of us are at the point of history, not memory in the sense that we were there. So things like enslavement, genocide, domestic violence, sexual abuse, extreme poverty. Remember, all this in terms of intergenerational are very, very significant in terms of trauma. Now, when these experiences have not been debriefed and taken care of so that there's safety, and in my case, let me say as a therapist, a lack of therapy, this worsens the symptoms and leads to transmission. Because they have not been debriefed, they are always raw. So the transmission moves from one generation to generation. When it comes to trauma, it's about recovery. Now, recovery is a process, so it's not a one-time event. So the safety and stabilization of the individual or the societies. There's the aspect of remembering and grieving, because in all this, you see a sense of loss. And what does loss do? Loss robs you of many things. And robs can keep you at the place of grief for the longest time. And finally, there is the aspect of restoration when it comes to intergenerational issues. That said and done, my parting shot would be, in most cases, adversity causes suffering, but adversity does not necessarily need to cause suffering, because 4 choices define our experience of suffering. There's a lot of fear, there's a lot of anger, there's a lot of pain, there's a lot of self-doubt. Now, there's a responsibility to shift these experiences to ownership And in ownership, there will be the aspect of uncomfortable human emotions and behaviors. And if we are not careful, we become victims. Remember, victims have no say. Victims do not have the power to take back their strength and responsibility and healing. So there's the aspect of ownership. There's the aspect of connection. Instead of retreating to isolation, can we look at the positive impact, the connection, and finally developing a solid, coherent identity with the focus of what is important and what is in our control. Coping strategies are usually very important because when it comes to trauma, there's maladjustment. But we need to invest our own conscious effort to solve these personal and interpersonal problems. One, in order to maintain or minimize the stress and conflict. And that is the responsibility of the individual. Thank you. And as a result, as a nation, we have a responsibility to create a narrative that makes sense of the situation and gives us meaning in helping us emerge stronger. Thank you. And light shines in the dark places at the end of it all. Thank you.
You are so full of wonderful ideas and reflections. Thank you so much. And almost every one of the sentences you uttered there at the end would be worth a few more lines of conversation. So this is obviously not the end of this conversation. I hope everyone has noted that there is an opportunity there to evaluate this session and perhaps also earlier sessions and the whole initiative of transitional justice and trauma healing. So do not miss the chance to participate in building up on this initiative. I thank everyone, using the words of Mariam Miringo there, that really I want to thank you all for participating, including quite a lot of knowledge coming from participants. And I want to give this opportunity to Susan to thank especially our speakers and also bring this session to closure. Thank you all. Susan, over to you.
Thank you very much. So my name is Susan Gier. I'm Junior Advisor at the Institute for Interreligious Dialogue and Islamic Studies. And on behalf of IRDIS, I would like to thank first and foremost our two speakers, Dr. Ochanda and Dr. Kasim. And I think what is the key message of this webinar is that we cannot stress enough the importance of mental health and social well-being, and also the related stigmatization. So thank you very much for your fruitful inputs, and also Idel for this really good moderation, and also Professor Hodan, Hodan Isse, who initiated this webinar together with SAS and IRDIS, for giving these really fruitful inputs, comments, and questions. So I just would like to use this opportunity to announce the next webinar, which will be again at the same time on the 7th of October. And as Dr. Chu has also highlighted, we would highly appreciate your feedback. So there are several options to do so. You can either scan the QR code. I also posted the link into the chat, or if you want to give personalized feedback, you can also write an email, which you can find here. So I think once again, I would like to thank all of you for your participation. So without your participation, this webinar would not achieve its goal. And I think also this came up very clear. So thank you very much. And I wish you all a wonderful evening. And I hope we will see us on the 7th of October for our next webinar. Thank you.
Bye-bye.
Thank you.
Thank you.